doing your assessment today. Nice to meet you. So I'm going to begin my assessment by just evaluating the overall appearance with the stated age versus appearance. Nutritional status appears to be appropriate. She's appropriately groomed. She's in appropriate posture and position. I would have checked her vital signs. She doesn't appear to be in any pain. Her mental status appears to be relatively normal. Her facial expressions are appropriate, as well as her affect and her speech. And she appears to be oriented to our time and place. So I would start our assessment by looking at the overall assessment of the skin, evaluating her hands, looking at vascularity, checking for any lesions, noting any clubbing in the fingers, palpating for temperature, turgor, texture, and I would continue the skin assessment throughout the rest of the assessment as I check each part. I would evaluate her head, looking for symmetry, size and shape, palpate the scalp for any tenderness, looking at hair distribution, checking for any infestations, any tenderness, lumps, or bumps. Looking at her eyes, checking for the position of them, evaluating the brows and the lashes and the lids. Looking at the conjunctiva and the sclera, and palpating the lacrimal sac. I would then evaluate the pupils, checking for consensual reflex. If you pick a spot on the wall and look behind my shoulder, and then look here, checking for accommodation. I would evaluate cardinal signs, evaluating cranial nerves 3, 4, and 6. So follow this light. Also look at her ears, making sure that they are equal in size, their position is the same, that their condition is appropriate, that there's no discharge. I would palpate the tragus and the lobes, the auricle. I would do a whisper test. Repeat what I said. Sunday. So I would also look at the nose, checking to make sure that it was symmetrical on each side. Check the skeletal areas, make sure there aren't any deformities or that the integrity is intact. Palpating the frontal sinus and the maxillary sinus for any tenderness. Can you breathe in one side? Breathe in this side. Checking the patency of each nerve. I would look at her mouth, checking the lips, evaluating the skin color for any lesions. I'm going to use gloves to check the inside of her mouth. We'll be evaluating the buccal mucosa. Checking the insides of the mouth for any lesions, spots, or irregularities. Can you stick your tongue out for me? Say ah. Evaluating the back of the mouth, looking for any issues or any lesions. Evaluating the tonsil and the hard and the soft palate. Looking at the gum and the uvula. Stick your tongue out for me. Great. To look at the tongue. Can you stick your tongue out for me? Looking at all sides of the tongue for any lesions. And then palpating the inside of the mouth for any lumps or bumps, any areas of tenderness. Noting also the dentation. Wondering if there are any missing teeth and the condition of the teeth. So at this point, I would evaluate the overall face, looking for symmetry, making sure that everything is in proportion. Looking at cranial nerve 7, I would puff the cheeks. Raise your eyebrows. Smile for me. Do you feel what I'm doing here? Touching, yes. Over here? Here? Yep. So at this point, I'll check for soft or for dull and sharp sensation. Close your eyes for me. So this is going to be dull. This is going to be sharp. Can you feel the differences? Yep. Okay. So tell me when you feel dull and when you feel sharp. Dull. Dull. Sharp. 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 Great. All right, now we'll move on and looking at the neck, looking for proportionality of the neck, looking at the trachea, making sure that it's midline. I'm going to check the sternocleidomastoid and the trapezius muscles. Can you raise your shoulders for me? Do it again. All right. It's checking cranial nerve 11. Clench your jaw for me. Okay. So at this point, I'll check the lymph nodes. I'll do preauricular, postauricular, occipital, tonsillar, submandibular, submental, cervical chain, supraclavicular, intraclavicular, and axillary. Great. So at this point, I'll do the back of your chest. Here I'll be looking at the skin, the overall contour of the shape of the thoracic cavity, checking for symmetry, any obvious deformities, checking the transverse diameter of the thoracic cavity, making sure that it's appropriately distributed, be evaluating the respirations of the patient. I would assess whether she was using any accessory muscles for respirations. I would palpate to make sure there was no areas of tenderness, lumps or bumps. And I would percuss, starting at the top. And then move my way down. Intercostally, evaluating the lateral lobes as well. At this point, I would auscultate her lungs in the same fashion, starting at the top. Take a deep breath. Auscultate, moving down the lungs, checking each lobe from side to side. Checking the lateral lobes as well. At this point, I would evaluate the patient's spine, making sure that all the vertebral processes feel that they're in line, no deformities. Checking range of motion. Can you lean forward for me? And lean back. Can you take a deep breath? And I'm evaluating that thoracic expansion is equal and bilateral. Okay, evaluating the anterior portion of the chest. I'm going to evaluate the skin and the contour. making sure that everything is symmetrical. There aren't any obvious deformities. I'll palpate for any tenderness. I'll also percuss. Here I would note any adventitious breath sounds. At this point I would check things peripherally, making sure that everything looks appropriate as far as color. I would check capillary refill. Checking for any vascular lesions or edema in the lower extremities as well. I would check pulses, radial pulses. Pulses. Pedal pulses. Tibial pulses. And carotid pulses. Now have you lay down. At this point I'll evaluate the heart. Inspect the precordium and make sure that there aren't any obvious heaves or lifts. Check for any pulsations. Palpate the apical pulse for any thrills. And I'll listen for S1 and S2. I'll listen for the aortic valve, pulmonic valve, tricuspid, and aortic. This time I'll use the bell of the diaphragm. While she's in this position, I'll check her abdomen. And I would inspect her skin. Looking for any scars or any defects. Contour and symmetry. Her umbilicus appears to be intact. Notice any inappropriate pulsations. No distension. I'll also take this as well in each of the 4 quadrants. Palpate for any tenderness. Percuss. And then I would do some light palpation. in each of the 4 quadrants, and then deeper palpations. While I'm here, I would also check the inguinal lymph nodes for any tenderness or any swelling, and check the femoral pulses. Okay. Have you sit up? Okay, at this point, we'll check the overall musculoskeletal system, evaluating for symmetry and the shape and size of the muscles, making sure everything is appropriate. Not detecting any irregularities in muscle tone or any nodules or lesions on the skin. So we'll check for a range of motion of each of the muscle groups. So if you'll hand me your hands here and pull up towards you and press down, press up, there you go. Can you lift your shoulders for me? Lift them up this way, all the way to the top, all the way down, behind your back. Can you press up with your feet and pull back towards you? Move into your, there you go. Inside this way, move both of your feet out. Excellent. I would inspect each of the joints for any tenderness or any crepitus. Grip my hand. Great. Okay, at this point, can you stand up for me? Hold your arms out straight. Excellent. Put your hands down next to your side and just stand with your eyes closed. Checking the rhomboid feature here to make sure that she's not feeling any dizziness. Okay, can you walk to that side of the room and back for me? Okay, I'm evaluating her gait at this point. All right, you can have a seat. You take your heel and go like this on your shin, and do it on that side as well. Excellent. And I'll check her deep tendon reflexes at this point.